If you are recovering from a major injury or surgery, you face a difficult reality. You are physically incapable of lifting heavy weights safely. This creates a significant hurdle for recovery. Established resistance training guidelines, like those from Kramer in 2002, state that building muscle strength requires lifting loads greater than 65% of your one repetition maximum. This is the paradox of rehabilitation. Your healing joint cannot withstand a 65% load, which makes traditional muscle building biologically impossible during this critical phase. The cost of this inactivity is high. Research from Wall in 2013 indicates that the human body can suffer a 30% decline in muscle strength after just a few weeks of disuse. Traditional rehab often hits a mechanical barrier, where the very steps taken to protect a joint lead directly to rapid muscle atrophy. Personalized blood flow restriction, or PBFR, acts as the scientific workaround to this mechanical loading problem. The intervention utilizes a specialized, medical-grade pneumatic tourniquet system applied directly to the upper thigh or the arm. This diagram shows the specific effect on your circulation. The cuff reduces arterial inflow, the blood entering the limb, by approximately 80%. Simultaneously, the cuff completely occludes the venous outflow, the blood returning to the heart at 100%. This means blood can slowly enter the working muscle, but it is physically trapped there, unable to leave the limb. This trapping mechanism creates a localized environment inside the limb that mimics the physiological conditions of high-intensity training. By doing this, the BFR cuff shifts the burden of triggering muscle growth away from the injured joint and onto the vascular system. To understand why this works, we have to look at the neurological size principle. When you lift a light weight normally, your body only activates smaller, endurance-focused, slow-twitch fibers. BFR disrupts this rule. Because the venous blood is trapped, the restriction quickly starves the working muscle of oxygen, creating a hypoxic state. Without oxygen, the muscle shifts to anaerobic metabolism, which floods the local tissue with lactate. This rapid accumulation of lactate and other chemical byproducts is what we call metabolic stress. Your nervous system misinterprets this chemical stress, treating it as an emergency signal that indicates the muscle is performing massive mechanical work. This leads to the hypoxic reversal. The brain's emergency response is to instantly recruit those heavy-duty, fast-twitch muscle fibers, bypassing the need for heavy weights. Burn isn't a sign of joint damage. It is the metabolic trigger forcing your nervous system to grow and protect the muscle. This isn't just theoretical. We can compare actual muscle activation of heavy lifting to low-load BFR. This IEMG data measures neurological activity. It shows that lifting a light weight at 40% of your maximum with BFR is neurologically identical to lifting a heavy weight at 80% without it. The takeaway is clear. Lifting a safe load for your joint triggers the exact same neurological response as lifting twice that weight. But we also need to see how that activation translates into actual tissue repair. For that, we look at muscle protein synthesis. Fujita studied this following low-load BFR training. The study documented a 46% rise in muscle protein synthesis 3 hours after the exercise ended. This data is why your physical therapist will have you lifting ultralight loads, often between just 20 and 40% of your maximum. The evidence shows lifting a light weight can trigger a physiological response of twice its magnitude, allowing you to build muscle while entirely protecting your joint. To achieve these results, you will follow the standardized Patterson protocol in the clinic. The goal is a total volume of 75 repetitions, divided into 4 distinct sets. You will start with an initial block of 30 repetitions. This large set is designed to establish the baseline metabolic stress. You will follow that with 3 smaller blocks of 15 repetitions each, creating a 30-15-15-15 structure. You will rest for exactly 30 to 60 seconds between each of these sets. There is one critical rule during these breaks. The pneumatic cuff must remain fully inflated and pressurized the entire time. If you release the pressure, you flush the limb, washing away the lactate and destroying the hypoxic environment required for growth. Strict adherence to the rep count and keeping the cuff pressurized is the only way to sustain the chemical triggers that force adaptation. As you perform the reps, you'll track your effort using the rate of perceived exertion, or RPE. By that final set of 15, the exercise should feel incredibly difficult, as if you are approaching total muscular failure. It is important to distinguish the burn of metabolic stress from unsafe sensations. Watch for absolute red flags: sharp nerve pain, total numbness, or any radiating tingling that extends into your fingers or toes. If you experience any of these, stop moving, deflate the cuff immediately, and alert your physical therapist. In summary, BFR uses a tourniquet to safely mimic the effects of heavy lifting by creating a localized, low-oxygen environment. This process accelerates protein synthesis and counteracts muscle loss without placing mechanical strain on the healing joint. Use this checklist to solidify the rules of engagement for your rehab sessions.